All right, so today we're going to go over some benchmarking information. So this is in regards to small businesses. So this will be important for you to listen to if you're a small business owner, if you work with or for small businesses, if you invest with small businesses. It's the 2022 report. It looks at the entire year of 2021, what small businesses are doing in regards to their employees. And it also talks about growth in small businesses and some inflation data. So stick around and we'll get through it. Okay, so let's first talk about where we're getting this information. We're getting this information from an online system that administers employee elections for their benefits and records contributions data, how many employees are being added and removed to the plans and to the payroll. So one of the great things about this particular report is that it's very user-friendly for small businesses. Most smaller businesses are implementing this particular platform over, let's say, an ADP, because in the small group market, the administration for a small business plan is a lot different than a larger group. Larger groups have direct feeds to the insurance companies, and Ease has found a workaround for that. And they're one of the ones that have broken through some barriers administratively in small business. So we haven't had a lot of small businesses or as much of implementation in small group for online services like this. Most small businesses in the past, let's say 5 years ago, all did their administration with paper, faxing, scan and emailing, things like that, where we're seeing this huge adoption around this work at home culture, as many of you know, and with that, Ease has grown quite a bit. So when we're looking at data, obviously the rule of large numbers applies. So the more groups we get into that pie, the more accurate the data is. So this is a review. This is a report I'm going to pull up here in a minute from Ease. Like I said, they're an online platform, excuse me, and they specifically target 1 to 250. So employers with employees of 1 to 250. So it's a small to medium-sized business report for benefits and employee insights. So again, employees are looking for an easier way. So a way to minimize repeating the same question over and over, repeated data entry, not entering things in twice. So this is a way that employers have been able to give consistent data to their employees at the same time. So Jane isn't getting a different presentation than Jack, and they're getting it all at the same time. And this has been very useful, and one of the reasons why we've seen small businesses really implement systems like this. And like I said, this is really the only system that's working consistently for small businesses with carriers and insurance companies that work with and specifically for small businesses. So why is small business so important? It accounts for 99.9% of all US businesses and nearly half of the private US workforce, which out of an impressive 61 million people evaluating their options for health benefits each year. With unemployment inching closer to pre-pandemic levels and a sizzling job market, attracting and retaining people continues to be a challenge. Recent surveys revealed that a staggering 88% of companies are experiencing higher turnover rates than normal, and same survey notes employees rank benefits as high as number 2 reason why they're looking for a new job, right after wages and salary. So we have seen this consistent in cost data as well. So employers are spending more and more money on benefits right after payroll. And this is why. So how can you stay ahead of the curve and offer benefits that matter to employees while remaining bottom line focused? So one way to do that is obviously to look at benefits data, see what employees are actually asking for, and do it that way. So that's what we're going to do. We're going to go through this report, and I'm going to pull it up right now. Okay, so this is the report. If you want a copy, please shoot me an email and I'm happy to send it to you, or if you're interested in this at all, happy to get you the PDF. The 2022 EASE Small and Medium Business Benefits and Employee Insights Report, National Data Trends and Observations for Small and Medium-Sized Businesses. So stand by, I'm getting a wheel. Stand by. And stand by. Okay, there we go. I had to close. I had like 22,000 things open. So here we go. So about this report, 2022 EASE Small Business Benefits Employee Insight focuses on businesses throughout the country. So it's nationwide with 1 to 250 active employees, with more than 4% of the entire small business and medium-sized business workforce making benefits decisions in EASE. We have a breadth of autonomized data to glean insights into how medium and small businesses redirect and evolved benefits throughout 2021 through analyzing EASE platform data from the past 4 years. So this is looking at 2018, 2019, 2020, and 2021. They have uncovered trends and key insights. EASE helps insurance agencies offer their benefits better services through technology. Today, over 2,000 agencies trust and EASE to support benefits, payroll, and HR needs for more than 75,000 employers and 2.5 million plus employees. Additional factors impacting. So one of the things that we've seen is inflation at the time of this report was 7%. In the largest December to December gain since 1981, the consumer price index climbed 7%. 2.2 overall healthcare prices increased, 0% prescription drug prices, 3.3% hospital services, 4.3% physician services. Physician services. So what we're going to review is we're going to review medical premiums and contributions, what health plans are being offered, voluntary benefits, what they are, and what we're seeing in the marketplace, small and medium-sized business growth, and some other insights. With a few glimmers of the pandemic relief, 2021 continued to be impacted directly and indirectly by COVID-19 through medical premiums across the board, though medical premiums across the board fell under the rate of inflation, so the 7%, it's higher than usual. We've seen consistently over the last couple of decades, or last decade or so, the consumer price index increases have been under medical inflation. And now for the first time, we're seeing medical inflation higher than or lower than the CPI data. The average EASE company saw an increase of premiums about 6.3%, with employers with 11 to 50 employees experiencing the largest increase of nearly 7%, so 6.87. Family premium, so we're going to be looking at EE, or employee only. That's if somebody's just enrolled as an employee through their employer, and then family, which would be an employee plus spouse, child, or children. So it can be employee plus spouse, employee plus child and or children, or employee plus spouse, child, or children. So there are several different tiers that are involved in the family premium. The family premium increased 3.35% on average. According to Kaiser, as I mentioned before in a previous presentation, I'm always keeping an eye on the Kaiser data. That's another source of information that has a lot of members. They control their member population as well as their hospitals and doctors' offices. So it's quite an extensive survey that we can review every year. And there are others, but that's one of my favorites. And according to Kaiser Health News, requiring insurers to pay COVID-19 testing, vaccine administration, and treatment means that costs will be passed on to consumers. So when the pandemic started, one of the government initiatives was to make sure that all testing was included in the preventive service side. So everything would be covered at 100%, which is great. And employees were extremely happy to be able to get all their COVID testing and vaccines and treatment covered at 100% by the insurance companies. However, there is going to be a cost impact for that down the road. The insurance companies aren't going to just take on that additional cost and say, oh, don't worry about it, we'll take care of it. That is going to be reflected in future premiums as an additional cost. Okay, so this is getting into monthly medical premiums. And so this is for the individual. So employee only premiums we're seeing in 2018, it was $494. In 2019, it was $510. In 2020, it was $541. And in 2021, it was $575, increasing 3% in 2019, about 6% in 2020, just over 6% in 2021. And an overall increase over that 4-year period is 16.2%. We've seen the highest increase to the population of the group of employers that categorize in 101 to 250 employees, which is considered middle market in insurance. So regardless of the company size, individual medical premiums averaged $575 in 2021. Employee count doesn't appear to have an outsized impact on the premium costs of this particular sector. So this is nationwide as well as not industry specific. Although we have seen white collar and gray collar implement these types of systems before blue collar. So you don't see a lot of general contractors and roofers and manufacturers in the ease systems. They are implementing those. We're seeing about, when they start turning into 20, 30 employees, you're seeing employers in the blue collar add these sorts of services more often now. But when this data first started being gathered, it was mostly that white collar and gray collar companies. Family premiums are not rising as quickly as individual premiums in small and medium-sized businesses. In 2021, the average family premium was $1,445. Unlike individual premiums, family premiums increased at a slightly slower pace of 3%. So one of the reasons for this is because it includes children. And traditionally, children don't have as many chronic health conditions as a population as maybe the working class. Working class, you see higher cancer rates, higher diabetes rates, things like that. So it helps offset some of those year-over-year costs. Employer contributions. So these are individual employee-only contributions. In 2020, it was $400. That has increased to $417. With the rise of individual premiums, employers are responsible for a slightly smaller share of total contributions in 2021, although the cost of about $17 more on average. The employee-only premiums. So employers did take on an additional 4% of the cost to help offset any premium increase that employees did have in 2021. And I saw this as well with my clients. So either increase their benefits or keep their benefits exactly the same. They didn't want to do a lot of changes in the middle of the pandemic. And then as 2021 rolled around, employers saw a strict job market. So they were more likely to add benefits than take them away. So we saw employers really beefing up their employee packages and offering more payment towards the employee premiums. Okay, stand by. I'm getting the wheel again. Okay, so employee contributions for individuals. So it was employer costs, and now we're going to be looking at employee premiums. Employee medical contributions. So in 2020, we saw employees on average contributing $141. It was increased to 143. So essentially the same, a very small increase. It was a 1.4% increase compared to the 4% increase that employers took on in that same year. Monthly medical contributions. So employer responsibility for family premiums has increased in 2020 to 2021. This may be response to ongoing pressures to acquire and retain employees. Yes, I would concur with that. That's exactly what I saw as a broker. A group to help lower rates, which could work out to a win-win across the board for premiums. So because you're bringing in that younger demographic, some insurance companies do come up with an average age for your demographics. So if you've got a lot of children in there, that can help with the rating calculations. Employee contributions for family. So in 2020, it was $572. That went up to $576 employee contribution. So we're seeing that, again, employers are throwing more money at insurance plans. This one in particular just went up slightly in each category. So the largest company segment paid significantly less per month, nearly $350 than the smallest segment in 2021. So here you'll see and what they're talking about is this group. So to 250 employees, the monthly medical contribution for families actually went down. And then for the other segments, it just went up slightly. On average, in 2021, following the trend we've seen since 2018, the smaller the company, the more employees paid towards their benefits. In fact, employees working for companies with 101 to 250 employees paid 22% less than those working for companies with 1 to 10 employees in this past year. On average, 2020 to 2021 increases were less than 1% across all companies, compared to the double-digit jump that we saw between 2019 and 2020. So here you'll see 2019, there was a 33% increase for groups of that middle market, 100 to 250 employees, for their total monthly benefit costs. So again, employers really wanted to maintain the benefits that they had or improve them in that year. And overall, it was a 44.54% increase over the 4 years in this group. Now, with groups that are smaller, 1 to 10, you'll see it's pretty much stayed the same. Over the 4 years, it was just a 1% increase in the same area. So the smaller employers have really just maintained their exact contributions, and the larger groups have increased their contributions. Holding relatively steady. The number of health plans offered by employers reflects the efforts to steer employees towards more affordable options. So what we're seeing as well is companies are no longer offering just one plan. We're seeing on average about 4 plans for most businesses. The past 4 years have shown the larger the employer, the more health plans they're likely to offer. In addition to that, I have noticed that groups that do have these online systems do have more options for their employees because it's more system based and they can communicate the plan offerings more efficiently. So it's not one HR person explaining 12 different plans to every single employee one-on-one. It's a system that the employees can click through and ask questions as needed in a call center or something like that. So they can roll out more options so the employees can choose the plan that's specific to their family's personal and financial needs and health needs. The larger the employer, the more health options that they're offering. And with that, what I'm saying is companies that do have a system like Ease are going to be more likely to have more options than a group that's doing everything by paper and doing everything by hand. So that's part of it too. Nearly 50% of small and medium-sized businesses employees opted to waive coverage, and that's declined by 5%. So we're seeing less employees over time waiving their coverage, although 50% is still a pretty decently sized number. We used to see about 20%, 2010 and prior. So it's still up over the last decade or so, that 50% waiver, but they're saying in the last 4 years, it was at 55% waiving, and now it's at 50% waiving. So number of plans offered to each employee, most groups are offering 2.5 plans. So 3 plans is the average. Smaller groups are more likely to offer 1 to 2 options. Groups that are 11 to 50 are offering 3 to 4 options. Groups that are 51 to 100 employees are offering 3 to 4 options. And groups that are 101 to 250 employees are offering 3 to 4 options. And what options are they offering? They have the categories of HMO, PPO, high deductible health plans such as an HSA or HRA, and EPOs and POS. So POS is not Urban Dictionary terminology. It is point of service. So oftentimes these plans offer an HMO feature as well as a PPO feature all in one. They used to be quite popular along with indemnity plans. However, we see less and less of those style plans. Okay, so most companies are offering HMO or PPO still. And they're speculating here that traditional plans may offer a more stable and comfortable option for people during a pandemic. So we did see the trajectory of high deductible plans and HSAs going up and up and up. And then it really crashed. Well, I wouldn't say crashed down, but the trend started coming down a little bit, and it looks like it's tabling off here. Probably because of the pandemic, people were not comfortable with going up in their deductibles during a pandemic. So they opted for more traditional plans as a PPO or HMO. And you'll see it broken down here between different sizes of employers. The larger groups, you can see a steeper decline in the offering for traditional plans. There's more high deductible health plans being offered the larger the group. As employers get larger in size, more employees choose to waive coverage. However, on average, fewer employees are choosing to waive coverage in 2021. So there's a multitude of reasons for this. It could be that employees feel more disconnected from a larger employer. Sometimes that is the case, and they tend to waive and go with their spouse, or they're going towards more government offered solutions. So, and meaning that if you have a spouse that's maybe a teacher or a police officer or works for a government agency, you may see employees migrating to those plans through their spouse more so than a private business. The government offered plans tend to be rich to government workers. And so because of the pandemic, you might see people willing to spend a little bit more money towards those healthcare options than we did in the past. That could be a reason that I've seen. Also, we have an aging population. We had a lot of people qualifying for Medicare the last couple of years, and employees that were resistant to going into the Medicare system and were just continuing to go with their employer's plan. With some of the changes, they might have been more open to looking at the options, or maybe they had some extra time to look at those Medicare options because they had time at home. I've seen that as well. So there's a lot of different reasons why this might be happening. And all of them are true, and all of them have happened in my experience. However, these are just the trends. You can speculate all you want on as to why, but it doesn't really define that here. There's not really a way to really see exactly why that's happening for this entire a large population. 64% say offering a wider array of non-medical benefits has helped their employee loyalty. So offering dental, vision, life was at the top of the list for employees. So they surveyed employees and said, hey, you're getting offered medical insurance. What other benefits would you like to see? And most employees said they want dental, vision, and life. There are also hospital indemnity, financial wellness, cancer insurance, legal services like a legal shield, pet insurance like VIP have also seen increases. So employees are asking for more options from their employer in these areas. Voluntary benefits. So in insurance speak, all those extras, the hospital indemnity, the cancer plans, the pet insurance, those are all considered voluntary options. So they're saying that most companies are offering 3 to 4 voluntary options on top of their traditional medical insurance. The larger the group, the more voluntary plans they have, which is exactly what I've seen across the board with my clients as well. So one of the reasons for this is because there's a 20% minimum enrollment. So if you have 100 employees, the insurance company is not going to offer you a voluntary plan unless you get 20 of those or 20% of your employees to enroll onto the plan. So the smaller the group, the harder that can be, because there's usually a minimum employee count as well that they require. So for example, a minimum of 20, a minimum of 20% or 20 employees, I've seen a minimum of 20% or 10 employees. So if you're a group of 10 and the minimum is 10, you'd have to get everybody enrolled. Or if you have 5 employees, hey, you don't have 10, so you can't do it. And same goes for the 20 employee minimum. Sometimes there are those minimum employee counts that do apply to some of these. So that's why we see more options to the larger employers, because it's easier for them to roll out these kinds of programs. Okay, so even though employers are paying slightly higher percentages of contributions for dental premiums, we're still seeing 11% drop in contributions. Okay, so not a big deal. I mean, most employers throw $30 a month at dental plans. That hasn't really changed too much. We haven't seen too much change in dental plans, especially during the pandemic. A lot of people got rate passes on their dental and vision because people weren't able to go to the dentist, right? The dental offices were closed, or the vision offices were closed, or people didn't want to go to the office in a spacesuit, so they opted not to go to the dentist. I am preparing my clients for a decent increase in dental and vision this year, or specifically dental, because I believe that more people are going back to the dentist this year, and they're probably going to have cavities because they haven't been getting their regular cleanings. Okay, so what are employees paying? Employees are also paying about $30 per month for their dental benefits. Vision plans, about $5 is the employer cost. Employees are paying 7 to 10 for their employee costs. This probably includes family as well. Accidental death and dismemberment, employers are consistently paying $6 to $8 per month per employee for these. And employees are paying around 4 or 5. So accidental death and dismemberment is attached to life insurance most of the time. And it means that if you die due to an accident, the benefit doubles to your beneficiary. And actuarially, you're more likely to pass away due to an accident in your working years than most other conditions. So, for example, if an employee passes away in a car accident and they have a $10,000 life insurance policy, they're going to get $10,000 from the life insurance and an additional $10,000 from the accidental death and dismemberment, for a total of $20,000 to go to the beneficiary. Short-term disability, about $10 per employee per month on average. This is most plans pay 50–60% if somebody is out due to a disability and they can no longer perform the functions of their job. The insurance company is essentially insuring the employee's salary for disability, for having a disability or where they're unable to perform their task at work. You also have employees are paying for this as well, $10 to $15. That has gone up quite a bit over the last 4 years, 40%. Long-term disability. So this is covering, so short-term is usually covering for about 12 months. And then long-term disability is covering someone until Social Security normal retirement age. God forbid somebody has a severe accident where they become paralyzed in some way and they're unable to work for the rest of their life. This ensures their pre-disability earnings, their salary. It's really ensuring their salary until Social Security normal retirement age. Employee contributions so employers are paying $13 to $15 per employee per month for this long-term disability, and employees are paying about $3 to $4. Okay, so this was really interesting. Small and medium-sized business growth. So small and medium-sized businesses have distinct advantage here. They have fewer layers to decision makers. So what they're saying is they've seen uptick in their business for small to medium-sized businesses. I would agree in what I've seen, and also an increase in ease of administration for smaller businesses. The sweet spot seems to be right around 20 to 30 employees is a great time to get online system implemented. When somebody has less than 20 employees, or let's say less than 10, they usually don't have an HR person. They usually don't have an administrator. A lot of times it's someone that is wearing multiple hats. Perhaps they're the bookkeeper and the CFO and the HR person. They're doing multiple tasks. They're the operations person and it can really slow down implementation. Or sometimes it's just the entrepreneur themselves doing it. Where a group that has 20 employees, they may have an HR person that's exclusively working with the employees on hiring and firing, adding and removing employees from the company and from the plan. And it's a one-point person that they have for implementing this. Now, if they start growing and you're looking at a group of 100, there's a lot more layers that we've seen in decision making and gathering data and access to data. Certain data may be omitted from the HR person that's working on the task. Maybe it's not the HR director, maybe it's the benefits administrator, and they don't have access to everything they need, and then they need to go to the HR person, and the HR person has to get it from the CFO, and the CFO has to get it approved by the CEO, So all they're saying is they're seeing a huge uptick in efficiencies for groups that are about 20 to 30 employees. And they are recommending that as companies grow into that space, into that 20 to 30 employee mark, that is an ideal time for them to get something like this off the ground. Average number of active employees. So their sweet spot here, again, is this 30 employee mark. And they've seen a 5% increase in groups growing from 1 to 10 to 11 to 50. They've seen an 11% increase of groups growing from 11 to 50 employees up to 51 to 100 employees. And they've seen almost a 5% increase in employers growing from 50 to 100 to the 101 to 250 category. So that's exciting. Okay, so I think of the rest of this, okay, there's a couple of wrap-up items that were interesting. So 46% will offer more worksite options. So employers are looking to beef up their insurance policies. So maybe an employer can't pay for a health plan that covers 100% of everything and $0 deductible, they can keep the plan that they have. They can afford to keep the plan that they have. And instead of taking that $25 and improving their contributions for the medical, it might make more sense to throw that money towards a new dental plan or towards life and disability. You know, that $25 that they're looking to spend extra per employee per month, it may be better for their hiring strategies and their recruitment strategies to add more options rather than just throw it at the medical plan. Everybody's moving online. Only 5% have no online capabilities in their business model. Work smarter, not harder, a little bit of a sales pitch here. And that's it. So again, if you found any value in this video, please give it a like, please subscribe. If you know of anyone that would be interested in this information, please share it. If you're interested in getting a copy of this report and you want to review it for yourself, please shoot me an email. And thanks for hanging out with me, and we'll see you next time.